Hello everyone, I'm sorry I can't be there with you today in person, unfortunately, but I hope you're having a fantastic event. Now, there's no two ways about it. We need to have a national care, support and independent living service. It should be free at the point of need and fully available to every single person living in this country. And we need it because over the last couple of years, I've been supporting my parents. They're at that time of their life where they need a little bit of extra support. And I've been shocked at how dire the situation is in social care. And if I, as a member of parliament, are struggling to get my parents the care that they need, when I know all the people who I can contact to try and get hold of some help, then how is it for other individuals, other families, or people with no family at all? How do they even know where to start in what's quite a dysfunctional and broken system? And we also need to end access to care being dependent on personal wealth and the social care sector often being delivered by private businesses who prioritise profits over people, and that those profits rarely trickle down to those hard-working carers on the ground. It doesn't go into improving care and the quality of living for their clients. Now, no one should be driven into poverty due to the costs of their care, and no care worker should be living in poverty or insecurity due to their poor pay and insecure working conditions. But it's prevalent across the care sector. And we can tackle care being a postcode lottery, subject to the whims of private investors who'll operate where they think it's the most lucrative rather than where there's the most need. And we can stop that feeling of dread when we think about trying to arrange support, how we're going to pay for that support, or fear that if the support can't be provided, then we'll have to go into care homes or residential settings. In short, we've got to put the care back into social care, and we've got to instil a belief that just like the NHS is a right to us all, social care is a fundamental human right. It's the backbone of a dignified society, and we don't have that backbone in our society at the moment, and that's what we need to do together to try and change things. Now, there's a few things that we can do to start trying to change things on the ground. We can set national standards that have to be met by all care providers and are monitored by an organisation with adequate powers to reinforce those standards. Services should be developed and delivered locally with full engagement with service users' voices at the heart of the design process, along with trade unions. And that'll ensure that people are getting their care needs met, ensure that money isn't wasted on initiatives inappropriate for the local area, and also mitigate against local NHS pressures as people are receiving the help they need to stay both physically and mentally healthy out of hospital and not ending up in a crisis. We also need to start now by ensuring that all carers are paid and supported adequately and fairly. They're performing an absolutely vital and essential service, which is both physically and emotionally demanding. And their pay or welfare support as unpaid carers, as well as the conditions like entitlement to paid annual leave, it needs to reflect that. A recent analysis by the Health Foundation found that 1 in 5 residential care workers in the UK live in poverty. And ensuring fair pay doesn't just help carers directly, but it'll also allow recruitment and retention of the best people for the job. It'll improve the service overall. Support should also include appropriate training, qualifications and career pathways for care workers to develop and support the skills to provide a high quality service in our communities. It should be seen as a profession, it should be paid as a profession and supported as a profession. Now, in terms of what the government's doing so far, we've not got to the National Care Service that I would like to see, that free, publicly run, owned by the people care service. But what we have seen is that they've started to look at fair pay agreements. They've announced £500 million to fund flagship social care policy in England and an extra £3.5 billion for social care in 28 to 29 in the last spending review. So that's great. I'll welcome that if it's followed through. But everybody here today knows that there are huge systemic problems in the social care sector, and a fair pay agreement is a kind of collective sector-wide bargaining. It's great, and worker bargaining power is going to make a huge difference to care workers on the ground. But the amount of investment promised so far by the government for the care sector is a drop in the ocean. It's not going to go very far when it's spread across the 1.5 million people working in social care and the millions of people who rely on that care. Now, the Health Foundation estimate that 2.3 billion is needed to increase care workforce pay in England to at least NHS Agenda for Change Upper Band 3. And that's excluding personal assistance. Now, if you combine that with the fact that local authorities are under extreme financial pressures after decades of austerity, and many social care providers are small, medium-sized businesses who might not be able to absorb rising costs, and we've got a recipe for disaster rather than an effective injection of much needed central funding. And we can increase central funding if we fully commit to ending the unfairness that we see in our taxation system. And that's a taxation system that sees income from wealth taxed at lower rates than income from work. What we need to see is a fair economy, one where everybody can contribute according to their ability and where those with the broadest shoulders carry the greatest burden. And there's huge support for a fairer taxation system. And when I talk about a fairer taxation system, I don't mean increasing taxes for the vast majority of people. I mean asking those who can pay a bit more to pay a bit more. Wealth taxes. And there's huge support for this. There's a group called Patriotic Millionaires who I've been following for some time, who are a group of patriotic millionaires who found that I think it was 70 to 80% of millionaires in the UK support wealth taxes because they think it's the fair and proper thing to do to deliver the public services that we need to see here in the UK. So the Chancellor needs to be bold in the budget coming forward. We can afford to properly resource a care service. We can afford to plug the gaps that we currently see in our social care sector. But beyond this, and longer term, we have to be bold. When we set up the NHS in the 1940s, it was like the social care system is now. It seemed like a Herculean task to try and bring something so huge and so privatised into the public sector so that it was run for the benefit of the people. But we did it, and it's one of our greatest achievements as a country. Our next greatest achievement has to be a national care service, where everybody, no matter where they are, whatever their income, is entitled to a decent level of social care, delivered to them when they need it and how they need it, without having to battle through red tape or difficult systems just to get the most basic levels of care. I know you're going to be talking about this at your conference today, and I'm looking forward to hearing the fantastic ideas that you're going to bring forward. And just know that my door is always open. So if you want to put forward your ideas and you want me to champion them in Parliament, then please don't hesitate to give me a shout and send them through to my office. But for now, have a great day, and thanks very much for letting me have the opportunity to speak to you all. Solidarity.